Seymour is our most popular wound care product. It's the one that we've been making the longest time. We are on the second version of Seymour. So our original version of Seymour, we stopped producing, it's over 10 years ago now. And we do still get calls from customers every once in a while asking how to clean those or some other random question on it. And when we find out the model's that old, our first thing is, wow, that's impressive, you've had it that long. The second thing is we have made some pretty big updates. So if you are somebody that has one of those old versions, quick, big changes. First one is going to be the material. So we changed the material. This material holds up a lot better to dressings. The one thing I will say, and this is something we say for all of our wound care products, are no matter what dressing you're putting on it, and for any product that we have, or other companies' products for that matter, is anytime you're putting the dressing on these, we definitely recommend taking the dressing off as soon as you're done doing whatever training or demo that you're currently working on. We do have some reps for companies. They will leave dressings on for days or weeks at a time. The material and the dressing is going to bond a lot more to this over that period of time. It's going to be a lot harder to get off, and you're going to reduce the life of the model. So we definitely recommend just when you're done, take the dressing off. You should be good to go. It should peel right off. The second thing that we changed when we redid the model is we updated all of the wounds. We did it to make the wounds a lot more realistic. So you can see in here, well, let me start and we'll go from stage 1 up. So this is our stage 1 right here. So the skin is not broken. As we go to this side over here, we have our stage 2. You can see the surface of the skin, that epidermis is slightly broken down. As we move to this side over here, this is going to be our, if I can point right, this is our stage 3 here. So you can actually see down in there a slight tunnel, and then up in this side here, we have a little bit of undermining. You can also see, if I get the camera the right way, you can see over on this side here, you can see that little bit of that subcutaneous fat. We also, on this side, we have our unstageable. So you've got the slough and some eschar, so it's covering the wound bed. We don't know what's down there. We don't know how deep it is. On the opposite side of the model, you have your deep tissue injury, as well as up here, a dehisced wound. So you can see that one there, the remnants there of where it would have been sutured or stapled together. And then up on the top, this is going to be that large sacral stage 4. So again, you're going to have your eschar here. You've got some slough shown here. You have the exposed bone, so we know it's a stage 4. Up at the top of the wound, you're going to have really deep undermining. And then in the lower portion of the, right over here, we're going to have pretty deep tunneling. So typically when people are using this model, what they're going to be doing is the first thing is going to be going over wound staging. So what stage is this wound? How do you know it's a stage 1, a stage 2, a stage 3, whatever it might be? You can go over that with people. Let them try to explain what it is and how they know it's that. And then the second thing is starting to go over how do you measure or gauge the progress of the wound, if it's getting worse or if it's getting better. So a big thing is, how do you measure? Whether you're using a simple ruler, tape measure, whatever you want to call it, one of those little guides, or even if you're using some of the new apps or the scanners with the cameras that are actually able to give you either area and or volume of the wound. Both of those, it's a good way to be able to practice, make sure people know how to either use the program on an app or on their phone or iPad, or how to measure it manually and make sure they're getting correct measurement. After you've learned how to measure and chart, then you can go into how would you treat the wound. So the big thing is going to be, if you have a stage 4, what dressings do you have at your facility that you can use on that wound to treat it? Whether it's basic ointments, whether it's a bandage, whether it's something preventative, whether it is all the way up to negative pressure on the stage 4. So each one of the wounds you can put on pretty much every ointment and dressing that's out there. The only thing that we know for a fact that we don't recommend using is any ointments or dressings that have silver in them. The silver will actually stain the model and you will not be able to clean that up. Other than that, we found that anything that's patient approved, as long as it doesn't stain the patient's skin, it shouldn't stain the model. So again, then once you're going into here, how do you do negative pressure? That's a big one, obviously, on a lot of these. So going in and learning how to cut the foam or to put it in the correct amount of gauze, filling in the undermining, and then putting the dressing on. So there's a lot of room around the wound, so you have the ability to go in there and put your dressing on, turn on whatever kind of a unit it is that you're using, and then make sure that you have a seal. That's a big one there is, if you don't have a seal, why not? And then how do you troubleshoot to figure out where that leak is and then how to fix it? And so I know in talking with clinicians, obviously most of the ones that we talk to at shows, they're on the educator side. And so they say it's been really nice for them because what they can do is if I'm somebody that's learning, I can watch somebody that's more experienced do it, whether it's on an actual patient or on the model. And then I can come in and practice without that pressure of having to work with the real patient. I can kind of go at whatever pace I'm comfortable at. And then I can also get feedback in real time where they can be honest with me and say, hey, you're doing that wrong. You need to try doing it this way, or you might want to try doing it a little bit different. And they can kind of give me those pointers and tips and tricks that maybe they've picked up over the years. So that's Seymour. Again, you can use the negative pressure on any of the wounds. If you do use it on the dehist over here, one of the things that's nice is you'll actually see that wound start to close up a little bit. We do have a video of that on our website where you can actually see it. It doesn't close up all the way, but it will start to bring those wound edges together just a little. You can kind of get that visual. So that's Seymour. Seymour does come in light and dark skin. It is soft, so it's going to be, maybe not as soft as a real person, but it is soft. It's fairly lightweight, even for the size that it is. So it's a great model. Should last you for 10 plus years as long as you take care of the model, like I recommended at the beginning there, taking the dressings off, cleaning it when need be, and storing it properly. There also is a smaller version. We'll touch on this one pretty quickly, but this is Stan, Seymour's little brother. So this one is going to be the exact same stage 4. What we did is we basically just cut the model down, and then we added over here, we added a small stage 3. So you get the same undermining, the same tunneling. Doing this backwards is hard. You get the tunneling on this side over here, the bone, the eschar, everything there. You're going to have the same ability to put any kind of dressing on it. Get that negative pressure practice, get the seal. Difference is going to be, obviously, it's a lower price point, and that's because you are losing those other wounds. And then also the model is smaller, so you can see definitely the size difference here if I stack the two next to each other. Obviously much different thickness as well as just overall size. And then the price difference is obviously something that's nice, or if you're somebody that's going to be traveling, if you work for a company, these can be kind of popular with anybody that's traveling a lot, just because it won't take up as much room. The next model we're going to touch on here is going to be Wilma. So this is Wilma. Again, like almost all of our wound care products, it does come in light and dark skin. So you have either option, and that gives you the ability, because some wounds will show up slightly different on different skin tones. So we've done our best to try to mimic that. And then the other thing is going to be, if you do have a patient population that is one way or the other, it might be better to have the product more adequately represents that. So to start out with Wilma, same thing, a bunch of different wounds on here. I'm going to go through them pretty quickly, but we do have a product legend on the website that has pictures of different angles of the foot, and it labels each one of the wounds. So again, this is a great way to be able to go over different conditions that could be present on a foot, from pressure ulcers to stuff that could be more diabetic in nature. So again, you're going to be able to start out here with the stage 1 on the ankle here. Then you're going to go to a stage 2 on the outside of the foot. We have a stage 3 here on the heel. You can see a little bit of slough there. On the other ankle bone there, that's our stage 4. So it's pretty small and superficial, but you do have the bone. So again, this is nice because a lot of times people get into the mindset of the size of the wound is what makes it a stage 4. It's the depth of it or the surface area that it covers, and really helping people understand this is one of those times where it's not that, it's what you can actually see at the bottom of the wound. So here we have that more superficial bone. Then as we work our way around the foot here, we're going to have some eschar on the outside of the foot here. You have a necrotic toe, and then in between the toe and there, you can see a little bit of a maceration in there. Yep. And then in between these toes here, You can kind of see here, we got little kissing ulcers there. The toes are kind of rubbing together. We have a callus on the tip of the toe here. And then on the top, there is a corn. Focus there. This here, your second toe, it's been amputated. And then on the big toe here, we're going to have a ingrown toenail on that side, fungally thickened toenail here, and then we have a blister on the outside, or I guess that's actually the inside of the foot there. On this side over here, we have this is stage 4 with a little bit of exposed tendon as well as slough. On the bottom of the foot, another callus, and then a full thickness ulcer over here. On the top of the foot, you have a suspected DTI, deep tissue injury here. What's nice on this one is that if I'm pushing on the skin around it, it's a little bit firmer. And as soon as I push on this area here, it is softer. So that's nice. You can get that difference of that softer, boggy feel. And then up here on the top of the foot, you have a stapled incision. So with the foot, you're able to go ahead, and it comes with the stand here. The stand, you can put the foot in 2 different orientations. So the first way, it's going to be standing up. So this is for 2 different things. One is obviously just showing people without having to hold it. You can show people what different wounds you're talking about. I could put it like this, and I could talk about these on the bottom of the foot and go over them. People could look, and it'd be really easy to talk about it. The other thing is going to be going ahead and putting it like this. Again, I can sit and I could talk about maybe the stage 4 over here, or I could switch it around and talk about the stage 3 on the heel. And that's nice for that. And then the second thing is going to be actually putting dressings on. So this gives you, so it's stable and not sitting like this and falling all over the table. You can place it here, and then somebody can practice putting something onto the heel, which is going to be a much more difficult location on the body, just because of the fact that you have your wound, and then on all sides it drops down. So you have to get that to wrap around. So whether you're using a basic bandage and you're making it work for the heel, or if you are using something that is a heel specific dressing, a lot of those that have their cut, or they have the ability to kind of just fold over really neatly for a heel, that way you can practice that one as well. And then, since we're going through these pretty good, I will touch on one more of our wound care models. This is our PAT, and it's our pressure ulcer staging board. So you're going to get a lot of the wounds that we just kind of talked about when we were looking at both Wilma, Seymour, and Stan. But you're going to get them in maybe some different formats, and they're all kind of located on one easy to see board. So as we start, we do have the dark section of skin over here, and you have the light section of skin on this side. On this side over here, you have your stage 1 on both the light and the dark skin. Then we move up, we have our unstageable wound. And again, that's unstageable with all the slough covering the wound bed. We have the eschar up here. We have a couple blood blisters on light and dark skin. Then we have your suspected deep tissue injury, again, up here on the light and the dark skin. Like we mentioned before, this one down here, this is going to be our stage 1, and that's going to be pretty firm. And if I go up here to our deep tissue injury, it's going to be soft. So again, those 2 look the same, and they're made the same. The only difference between them is going to be that soft, boggy feel to them. So it's getting people understanding that you can't just look at a wound. Sometimes you're going to either have to touch it, feel if there's a difference in the softness, firmness, temperature, or getting in there and measuring to see how deep something is. You can't, that visual, just quick look isn't going to give you all the information you need. As we move over to here, we're going to have your intact and ruptured blister for our stage 2s. Down at the bottom here, we have a stage 3. This is going to have our eschar off to the side here. Again, like on the other stage 3s that we had, we do have a little bit of undermining there. And then the bottom there, you can see a little bit of a tunnel going down. The last 2 wounds are going to be these 2 on the side, and these are both our stage 4s. And so like we had talked about on the Wilma, again, getting people to understand, one of the things we keep hearing from people, and we heard especially when we were developing these models, is people automatically go back to that size is what stages at a stage 4. So we gave you 2 different stage 4s to be able to look at. This is that small superficial one off the malleolus on the foot. So again, very superficial, small in size. And then we gave you a larger one down here, both in surface area as well as in the depth. But you still have that bone, so we know it's our stage 4. This one again has some undermining up on the top here, and then it does have small tunnel there up underneath. So this one's great because you can go through all the different wounds quickly. You can explain to people what each wound is, why you would stage it that, what might be causing it, what might be things you should look at if the wound gets worse, how you would treat it, go through all those different conversations, all those different scenarios with people, and give them the ability maybe to suggest to you how they would go about treating it or what they would look out for in the future. On any of these models, they all will be sealed. You can put moisture in them. I know a couple of companies that actually make the irrigation wound vacs or negative pressure systems. They actually will use some of these for their demoing. So all of them will be sealed. All of them will work with negative pressure. Again, the biggest thing is take that dressing off when you're done doing your demonstration or training. And then if you do put anything in there that's liquid, I would definitely make sure that it's fully dried before you pack it up, because if you don't, seeing this both with our models and other companies' models where people put it away wet and then they pull it out in 3 months and mold has grown. So just make sure you let it dry completely. All right, guys. Well, thanks for joining. Thanks for the questions. Again, if any questions pop up, feel free to reach out to us afterwards. We'd be happy to answer anything. We also do have a feature on our website now where you can actually just schedule a little demo just like this. So if you or anyone else is interested in any of our products, you can go onto our website, hit schedule a demo, and pull up any times that we're available. You schedule it, you tell us what products you want, and we'll do one of these kind of one-on-one with you or with anyone else from your company or organization. And we'll just kind of go over the products and try to answer any questions you might have.